With a number of healthcare reforms planned by the previous administration, we ask Azrul Mohd Khalib, Chief Executive of the Galen Centre for Health and Social Policy, on what Dr. Zaliha should focus on in the first 100 days in office.
The first one is of course, the health reform white paper, which is something that's really, really important. I argue that this is one of those documents which are just as important as the RMK, the Rancangan Malaysia, simply because the need to urgently reform Malaysia's healthcare infrastructure is actually overdue. And the good thing is that the health reform white paper has managed to, within a short period of time, I argue within like 6 months or so, has been worked on by experts, current and retired healthcare professionals, communities, stakeholders from all parts of the health sector. And it combines, I would say, hundreds of years of experience, of what needs to be done, what needs to transform and future-proof the landscape of Malaysian healthcare. And the second one that we put forward and recommend for implementation the first 100 days is the Tobacco Control Bill. We feel that this bill should be tabled and voted on in the Dewan Rakyat within the next session or so. Maybe not the first session that's coming up, but maybe certainly in the following one. This bill was worked on and reached a compromise by a Parliamentary Special Select Committee, which was bipartisan, and contains many of the same parties that are now the government, and even those who were not. And it has been worked on very hard to accommodate the views of all parties. And if you want to look at a showpiece of different parties coming together from different positions and views, wanting to work to shape a healthier future for Malaysians, this really is that. And, this is a bill that's, I would argue, oven ready. You can put it in the oven, you can cook it today, and it deserves to be tabled, and it should have the support from the parties in Parliament.
In the long term, Azrul advised for the Health Minister to focus on 4 things: sustainable healthcare financing, investing in non-communicable diseases, mental health, as well as elderly care.
The first one is to look at sustainable healthcare financing. The way we're financing health today is not sustainable. It's dependent on tax revenue, which is very vulnerable, and most importantly, it isn't able to meet the needs of what we have in store for the next couple of years. We need to be able to find a different way of financing our healthcare. Second is to respond effectively to the crisis of non-communicable diseases such as diabetes, chronic kidney disease, hypertension, obesity, cardiovascular disease, all of which contribute a huge cost to Malaysia's economy. And most importantly, it is making our people sicker. We need to be able to have solutions for that. And most importantly, to have the political will to implement some of those tough policy changes and regulations that need to be part of the response. And the tobacco bill is one of those. The third is to close the gap on mental health. Because right now we have neglected the health aspect of our healthcare. And post-COVID, we are seeing more and more people who are falling into depression, who are facing mental health illness and need assistance. And unfortunately, Malaysia's healthcare system is ill-equipped to be able to deal with that. And of course, the last issue that we actually need to be able to address is, of course, the gap in aged care. More and more Malaysians are becoming older. 15% of the population is going to be more than 55 or 60 years of age by the time we hit 2030. Are we prepared for that? Are we able to provide the kind of care and treatment that's necessary for aged care? And the answer to that today is no, we're not.